Hi, everyone. My name is Leah Swanberg, and I'm the owner and founder of Egg Helpers and Canadian Fertility Consulting, an egg donor and surrogacy agency located in Canada. I'm located on Vancouver Island, and our staff is located across Canada with offices in Alberta, Manitoba, Ontario, and of course, where I reside in British Columbia. It's my pleasure to speak with you today. I wish I was there in person. However, at this time, I am flying from Canada to Australia to attend the Growing Families conference in Sydney. Today, I would like to share with you the simple steps to creating a family in Canada through egg donation and surrogacy. Next slide. So, we really believe there are four key components and criteria to building your family. And the first piece is to find a legal professional in your jurisdiction. While I can tell you and share the amazing experiences of other New Zealanders having gone through surrogacy and egg donation in Canada, what I can't tell you about is what the process was when they got home to New Zealand, as that is different for each person based on where they move forward with the surrogacy in Canada, how quickly they returned home, and the parentage process there. So find a lawyer in New Zealand. I'm certain there will be one speaking either after me or maybe has spoken before, but they are your first stop. And then from there, a legal professional in Canada. You're going to hear from Cindy shortly, who is a lawyer who has worked with many New Zealanders and is going to be an amazing asset to your team. These lawyers will help you with the contracts for or between yourself and your egg donor, ensuring that your donor understands her roles and responsibilities as a donor, and that you as well understand your roles and responsibilities as an intended parent. The lawyer will also help you draft an agreement that not only respects the Canadian law around surrogacy, but also ensures that all of the nuances and pieces around the New Zealand legislation is contemplated in that agreement as well. Next stop will be a doctor. We want to do a couple things, and I actually don't even have it on here, or I do at medical testing at the very bottom, referring to the surrogate and donor. But I want to suggest before you even engage in surrogacy in Canada, the US, or wherever it is that you're going, that you talk to a doctor in Australia, or sorry, in New Zealand rather. We've had many couples who have come to us and they're ready to proceed with surrogacy. They have an absolute requirement, whether they're a same-sex male couple or whether they are a heterosexual couple where the intended mom has a fertility issue, and they just sort of forge ahead and then realize that maybe one of them could have used some treatment or some supplements as sperm quality was low. And so we always suggest, talk to a doctor in your community about your health and about moving forward with surrogacy or surrogacy and egg donation. Um, Choosing a clinic is really important. For us, we recommend clinics based on what you are looking for. Many of our clients come to us and say, I'd really like to work with a clinic where we can do gender selection. And so for us as an organization, we know that can only occur in the US. So we'll refer you to a US clinic. If you are looking for a clinic that is going to be located closer to your surrogate or your egg donor, we will definitely suggest a Canadian clinic. And oftentimes, people choose their egg donor first, then their clinic, to ensure that their donor, who is going to have 10 to 14 appointments, can do that fairly locally. And we work with clinics across Canada, so would be more than happy to make a recommendation and a suggestion for you. Now, if you have embryos already created in New Zealand, we are so fortunate in Canada that we can receive those embryos very easily. We work with fertility clinics who have transportation departments who will work with your clinic to ensure a couple of things: that the clinic in Canada has the instrumentation an understanding of how your embryos were frozen so that they can thaw them with the best chance of success. And then finally, medical testing, ensuring that, we've already talked about your medical testing, but your surrogate's medical testing, your egg donor's medical testing, ensuring that the clinic you work with not only does sort of basic medical testing, but that they're also doing genetic testing to ensure that your child is going to be as healthy as possible when that day comes. Finding a surrogate. Listen, you can work with me. I'd love to introduce you to my team. I'd love to help you find a surrogate. But here's the thing, you don't need us. Many intended parents work with a lawyer in their jurisdiction, a lawyer in Canada. They find their surrogate themselves. And the way they do that is through amazing groups on Facebook, amazing communities in which intended parents, egg donors, and surrogates connect. It is a great forum for connecting, as you likely know. How many of us have found old high school friends, our old childhood neighbors? Surrogacy is no different. Egg donation is no different. So many people are advertising on Facebook or other communities. When you're looking at advertising or looking for a surrogate or a donor, location is important, and most specifically with your surrogate. If you are a couple or a person who has adopted or has received donated embryos, it's important that the surrogate lives in a jurisdiction that you can be named as parents if that is the case. So it's really, really vital that you get that information from your lawyer around the location of your surrogate, given your situation. Um, Screening your surrogate, obviously, so important. And I would say the same. I would say the same with your egg donor. We want to make sure that everyone is healthy and able to move forward in a way that is going to honor your surrogate and egg donor's health as well as your child's health. When we look at the journey, we look at a few things really specifically. Figuring out your budget. If one of you in your relationship is the spreadsheet person, get out that spreadsheet. If you're not, create one. You want to really have some key pieces of information down, and whether that is fixed versus variable expenses. So we know a fixed clinic may be the clinic cost. We know a fixed cost may be the egg donor agency or surrogacy agency if you go that route. What we don't know are if bed rest occurs and you are covering your surrogate's lost wages or other out-of-pocket expenses. We want to make sure that you budgeted for that, even though it is, as I said, a variable expense. So really talking about what that looks like. The next piece I would say is tough talk. There are conversations that just have to happen. And those conversations are typically around selective reduction if high order multiples occur, termination if there's a medical abnormality with the pregnancy, type of relationship. If a relationship breaks down, this is the most intimate experience, intimate journey you will have. And often it is with a complete stranger. So building in, preparing for tough talk. How do you deal with tough situations in your life? And sharing that with the surrogate around your style of communication will be really important. The details, there are so many details in, that sort of fold into surrogacy, fold into egg donation. And so really doing your research, speaking to other intended parents, speaking to lawyers, speaking to the doctor, speaking to agencies, whether you decide to move forward with them or not, get their paperwork and use it as a guide, use it as a tool for having all the conversations around all of the details with your surrogate. And if you choose a known egg donor, with your egg donor. Jordan, next slide. So as I said, when an agency isn't necessary, when it's a sister, cousin, friend, when it is someone you've met online and you've been able to establish the supports that you need with the fertility clinic, with a lawyer. I would add at this point with a counselor, making sure you have a counselor along the way. With our agency, it's included in your agency fee, a therapist that's available to your surrogate, to your egg donor, and to you throughout the entire journey and up to 6 weeks post-birth. We really want to make sure that not only are you going home with a child, of course, that's a huge priority for us, but that your surrogate is leaving this experience feeling cared for and as though she participated in something that was meaningful for her, not just handing you a baby, but that fed her soul as well. Getting home with the baby, each province in Canada, each jurisdiction has a bit of a different time length. But as Cindy will talk about, 2 weeks in Ontario, 3 weeks in Alberta is a typical time frame. So that's our last slide. So thank you. I'm going to pass it over to Cindy now, who will speak about the legal process in Canada and help you with that. Thanks so much.
Thank you so much, Leah and Jordan. It is an honor and pleasure to address all of you, and I wish I could be there in person. And as Leah mentioned, we will be speaking at the conferences as well in Sydney. Although she'll be in person, I will be joining by Zoom. So I've had the great honor of addressing New Zealand audiences for several years now, speaking about our process in Canada, and have worked with some of the lawyers there as well to ensure that intended parents transfer legal parentage in a safe and easy way. I'm going to speak for a few minutes about the legal process here in Canada so that you understand what you will need to do to comply with New Zealand law. And the lawyers who speak at both the conferences in Auckland and Wellington will explain to you, if they haven't already, that you will be doing an adoption process there. And so when you come home with your baby, it will be a Canadian citizen traveling home on a Canadian passport. You will have a birth certificate naming one or both parents as you wish from any jurisdiction in Canada based on where the surrogate and the baby are born. So if your surrogate is in Alberta, you'll go to the court in Alberta. If she's here in Ontario, where I practice, you will get the declaration of parentage in this jurisdiction. Birth certificates are issued by each provincial registrar. And then the federal government issues the Canadian passport once you have a birth certificate proving that you are your baby's parents. So our job as the Canadian lawyers is to assist you at the early stage with donor contracts or surrogacy contracts and the parentage process. There are 3 essential services. Once you find a donor, your agency will refer the donor to a lawyer, and we will draft the contract between you and your donor. There is no legal difference in Canada between a known or anonymous donor. So it's a good thing to think about beforehand whether you think it's in your child's best interest to know who their donor is in the future. When I had my children through donation and surrogacy, I chose a known donor, and it's become a very important issue for my children. They're glad they know who she is. And that's something for you to think about. There is no rights that a donor has in Canada to parentage, so you never have to worry about that. With the surrogacy agreement, it's a lot more involved. In order to register as parents, the court or the government of the province will look to see that your surrogate had independent legal advice separate from you. And so that's why the lawyers draft a contract, which sets out all the rights and obligations between you, as well as pages of financial reimbursements, so that we get all the difficult work out of the way prior to the transfer, leaving you and your surrogate with 9 months of talking about how sick she is or how many times the baby is kicking and driving her crazy, all of which is actually good for you. So we want you to have a wonderful relationship with your surrogate, as Leah has mentioned. So we'll get all the legal things out of the way. The reimbursements in Canada are based on an altruistic model. That means no compensation at all. The government, however, is very generous with what it says you may reimburse. Anything related to the donation or surrogacy will be considered legal. There are no caps, so each surrogate and donor will speak to the agency at intake to go through a very very thorough process of what her needs would be and what she anticipates expenses will be. Of course, things happen, and we cannot account for things that happen in a pregnancy. It's a human process. So you must be ready for worst case scenarios, and we hope, of course, that they don't happen. But the lawyers also go through it with the surrogate and with you to make sure you are aware of all potential liabilities that you will owe your surrogate for reimbursement. And the agreement, of course, between you and your surrogate will set out that she will give you custody of the baby when it's born, and that you will make all parenting decisions right away at the hospital, and she will assist and facilitate in any way required to register the birth in your names. So once the baby's born, we do that. Registration can occur the traditional method available in all provinces and territories, which is a court-ordered declaration of parentage, where a judge names you as the only parents and also declares that the surrogate is not a parent, both positive and negative, and then orders that the registrar of the province register the birth in your names and issue a birth certificate accordingly. And then you take the court order to the registrar with a request for the birth certificate, pay a little bit of money, and voila, you've got a birth certificate. In some provinces, such as Ontario where I live, there is a streamlined process called a statutory declaration. You no longer have to go to court in Ontario, British Columbia, and I understand Prince Edward Island has just begun to do these as well. Their law came into effect last year, but because of COVID, it really didn't happen. So in those three provinces, there is an administrative process which would cost you a lot less if it's available to you. You still end up with a birth certificate, just no judge's order. And your New Zealand lawyer will tell you whether you really don't need that lawyer or not. But of course, if you're in a jurisdiction like Alberta, Saskatchewan, Manitoba, you will have no choice but to have a court order. And so that is the registration process. Once you have that birth certificate, as I said, the federal government of Canada will issue a passport with your application. And my firm will assist in that work if we're retained on that process. And so those are the three legal processes and the outline of how they work, as well as information about how reimbursements work. In Canada, I'd just like to speak about citizenship for a moment. Anyone who's born in Canada will automatically be a Canadian citizen, and as such is entitled to that passport, which you apply for. Citizens of Canada are always welcome home, even if they live abroad. And when they're 18, they are entitled to sponsor their parents who are foreigners to become Canadian citizens. They must, of course, be living here, and they must show that their parents are healthy and capable of supporting themselves for several years. So if you send your 18-year-old back home to go to university or get a job, perhaps being a ski bunny at Whistler or working a bar, then they could apply for your retirement years here, and 18 does come quickly. So those are important factors to consider. A big difference between the Canadian and the US legal system is also an immigration and citizenship issue related to taxation. Any US citizen living abroad will be required to report income to the tax department of the US, the IRS. We don't have that provision in Canada, so you don't have to worry about that should you have a concern surrounding that. And then, as we've discussed many times, healthcare is also an issue. Legally, all residents across the country are entitled to free healthcare, which of course we pay for through our taxes. And it is based on the residents of the province. So your surrogate will have healthcare. Your baby would only have healthcare if it were going to live here. And because we recognize you as the parents, knowing you're going to go home quickly with your baby, you will receive a bill from the hospital, which you should not allow your surrogate to pay for. So you will want to have that newborn health insurance. While not legally mandatory, it is best practices, and most agencies will not assist if you don't have it. And so those are the major legal considerations. There are two other minor ones, but very important. extraneous, I should say, to the system. One is that you should have a will in place. So you'll want to speak to your local lawyer to ensure that's done prior to the first transfer. And the reason for that is because if some tragedy occurs and you both die with your surrogate pregnant immediately after a transfer, even, then you'll have a problem. So you want a will done that recognizes that there is a Canadian woman carrying your child, that there is a contract for which your estate is liable to continue the reimbursements, and also indicating that there is a guardian who will come to Canada and take your baby. The laws of each province provide that the birth can still be registered in the names of the deceased parents, and so your guardian will work with the lawyer to make sure that that happens, be able to get the passport and return the baby home. So you need to make sure that if that happens in your local country or where your guardian might live, they will be able to do so. And then finally, there is the issue of abortion. This is a very difficult topic for most of us to talk about, given what's going on south of this border in the US. As you are likely well aware, the issue of abortion rights in the US is being downtrodden by the court, and in state after state, there will be no abortion allowed, and there will only be a few places where it will be allowed in the short while. In Canada, that is not an issue, which means even if you're considered the parents of a baby that a surrogate is carrying, you will not be able to ask her to have an abortion in those US states. But here, you and your surrogate will have that discussion, and it will be on her profile at intake so that you are only matched with a surrogate who shares your values completely from her heart with no pressure. And then we won't have a problem. If there's something wrong with your child and you've elected to terminate, sadly, because of that, you will have a surrogate that can do so safely in Canada up to approximately 22 to 25 weeks now, based on medical appropriateness at the time. And so I think I've covered all of the legal issues, and I think that will be it for me at this point, and it's been a great pleasure. I'm sorry that we are unavailable to be present even on Zoom, as Leah will be flying en route to Sydney, but my email contacts will be available through Growing Family should you have any questions. And I will also be available at the Sydney conference on Zoom, so if you can log in there and you want to watch or ask questions, we'll be there as well. Thank you all so much, and I hope to see you next time in person.